Okay, so croup, laryngotracheobronchitis. So croup is, the questions that typically come here are divided up into upper airways and the smaller airways. So the upper airways, one of the diseases is croup, laryngotracheobronchitis. This is mostly seen in children under the age of 3, and it's caused by parainfluenza virus. There's a number of different viruses that can cause it, but the most important one is a parainfluenza virus. And how do they present in a question? 3 main symptoms that are going to differentiate this from other things like bronchiolitis, epiglottitis, and pertussis in children is they're going to present with a hoarse voice. They have an inspiratory stridor, which can also be described as a high-pitched wheezing sound due to turbulent airflow. So, and the third one is a barking cough or a seal-like cough, also can be described as harsh, brassy cough. So those are the 3 main symptoms. This is a clinical diagnosis. So an x-ray is not needed, but if they do give you, just as a clue, the x-ray is going to show you that steeple sign, which is a subglottic narrowing, but that's not really specific. So where do the questions come from? In all these symptoms, they can come from anywhere. And most of the questions come from the treatment. So the treatment is dependent on mild disease or moderate to severe disease. So how do you know exactly? Because a lot of stuff today is based on guidelines. So you need to know exactly what mild is and what moderate to severe is. So mild is there is no retractions and there is no stridor. So, and you still have the rest of the symptoms, the other 3 symptoms we discussed. But if it's moderate to severe, they will have retractions, they will have stridor at rest, and they will be also anxious and agitated. So if it's a very mild disease, the treatment is to put on a humidifier and give them like cool mist. And you can add plus or minus steroids depending, but the main thing is a cool mist and the humidifier. But if it's moderate to severe, where they're showing those the stridor at rest and the retractions and the agitation and the anxiety, if you're noticing all that, then you need to give them the epinephrine and a steroid. So that's one way of, and that is the nebulized epinephrine, by the way, when you give them the epinephrine. And of course, if things are getting much worse, you always have to intubate them. Okay, that's how you do croup.